Coming up today, athletes eat differently. More calories, more nutrients, more food. What should female athletes specifically be doing to maximize their performance? Plus, we return to Royals spring training, what team doctors preach about player nutrition, and indulging on St. Patrick's Day, the holiday heart risk that doctors see every year. And good morning. It is Thursday, March 16th. I'm Jessica Lovell. Welcome to the Morning Medical Update. Today, we meet a doctor dedicated to keeping girls and women engaged in the sports they love. With me in studio is Dr. Lisa Bopat. She created a new program just for female athletes here at the health system. How are you?
I'm good, thank you.
Good to see you. This program, it's the only one like it in the region and one of the only few in the country. And joining us virtually is Sarah Kostelnik, a registered dietitian, and more specifically, a sports dietitian who helps youth, college, and even pro athletes get the most from their meals. So good morning, ladies, to both of you. Dr. Bopat, I want to start with you. The health system already has a sports medicine department. You, though, took it one step further. This has been your passion, and I want to hear a little bit more about that. Creating this athlete program, why was it so important for you to focus on women and girls?
So women's sports participation has significantly increased over the years. So Title IX, we're sort of in the 50-year anniversary of that right now, more or less mandated that there would be no or banned sex discrimination in federally funded education programs, and then it just trickled over into sports. So we've seen the participation rates rise since that time. Which is great. So there's the, in 2020 in the Tokyo Olympics, we had almost near equal participation rates. So 49% of participants were female. And we're seeing that both in high school and collegiate level as well. But, even though we're having these increased in participation, it's becoming clear that we're seeing changes in injury rates and issues specific to the female athlete. When it comes to the injury rates that we've been seeing, women are unique beings. And across the board, females are having higher injury rates compared to males in all types of injury. In gender comparable sports, we're seeing increased injury rates in females compared to males. Females have 2 times the ankle sprain rate of males. Females have up to 10 times the rate of ACL injury and tear compared to males as well.
So it's about time they are seen differently. Different bodies, different sports, they get injured differently and they heal differently.
Yeah, completely different patterns, different mechanisms of injury, and different rates of injury. So it's about time we start looking at males and females differently in terms of care.
So you are an athlete yourself. You played soccer. You played competitively, correct?
Yeah, I did.
Tell me a little bit about that history.
Yeah, so I was a soccer player my entire life, basically since I was 5. And I participated both in club and high school soccer and grew up just north of Boston, Massachusetts, which was sort of the major sport for females in that area. So that was, sort of my interest growing up.
And you have a really cool background because you said you got your training in Boston, and I was asking you if there was any place like this in the country. Tell us about that.
Yeah, so I went out to the East Coast for my medical training and then did my sports medicine fellowship at Boston Children's Hospital in sports medicine there, where my mentor, Kate Ackerman, basically started the world's first female athlete program. And so, much of what I learned in regards to the female athlete, I learned from her. And then I stayed on staff there at Boston Children's as part of the female athlete program for the 3 years thereafter before coming to KU about 7 years ago.
Which you said you've been pushing for this ever since.
Ever since, yes.
And here we
saw
are.
The need, I saw the importance of having a comprehensive, holistic, sort of multidisciplinary team and treating the female athlete and all the female athlete's needs, and just knew we should offer that here.
And compare that back to when you were playing competitively. How have we grown? And you must have seen that need back then and certainly up until this point.
Yeah, the need has changed and been increasingly recognized. So when it comes to sports medicine science, and all the protocols that we look at to drive how we care for athletes, the science is all based off of males. So there's a really interesting study that came out in 2014, so about 10 years ago, that looked at the 3 top sports medicine journals in the world. And they took a look. It was a really simplistic study, but a very powerful one. And then it took a look at the number of female versus male participants across all studies in those 3 journals. And females were only represented 39% of the time. And then we took a look at female-only studies. The numbers were even significantly lower. So males were represented in male-only studies about 18 to 34% of the time, and females were 4 to 13%. So the female athlete hasn't been studied. And everything that we're doing in sports medicine is taking all of this science based off of males, male anatomy, male physiology, and then trying to apply it to females, and we're really doing them a disservice.
And you are leading the charge to make that change.
I am.
Much appreciated. Let's talk about nutrition. We know that is such a huge part of sports medicine and staying healthy. There are, of course, stereotypes about what women eat and how much women eat. So, Doc, how do these stereotypes conflict, though, with what athletes really need, the female athlete?
Yeah, the athlete is its own being. So we have to look at the athlete's needs much differently than we do general population. So even though different types of cultural diets have been pushed for general population, these types of dietary practices really don't have a role in athletics. So Sarah will speak more on that, but in terms of, fueling the body, the female athlete in particular needs to run off of carbohydrates, needs a certain amount of essential fats. And so some of our cultural dietary pushes, such as low-carb diets or eating too clean and healthy or low-fat diets, really have no place in the diet of a female athlete.
The carb, the C word, nobody wants in their diet. So much needed. Let's bring in Sarah. This is your lane. What do you tell patients who are trying to balance what society is expecting and what their sport demands?
Yeah, so there's totally a gap between, what a female is expected to look like or eat or the type of exercise that they should do. And then there's what the true reality of a body size, that a physically well female athlete lives in and the high energy needs that are associated with their level of activity. So, I hear this a lot in my sessions with patients, and I do really like to validate those feelings that my female athletes have. It's truly, unfortunately, normal to hear these things. In fact, they're pretty much everywhere you turn. You see it on social media. You see it in schools sometimes, even on, in some toxic sport team environments. And these are just inappropriate false messages portrayed to girls and women in general. But, since there's such a gap we see, it affects female athletes even more. So we hear things like, smaller is faster, thin is more feminine, bulkiness or having muscle, that's masculine, or you should weigh less than blank. And so over time, when I work with these patients, I like to help change really their internal narrative by just sort of providing a truth rebuttal to that negative self-talk. Unfortunately, negative self-talk is very common, especially in a female athlete's internal dialogue. So when a thought like that pops up, thin is more feminine, I first like to recognize, hey, we're talking to ourselves like that. This is part of our internal dialogue. And then we sort of push that to a distance. We don't ignore it, right? But we push it away, and I like to try and help them reframe it to something like my physical health supported by the body size that I'm in, and power and strength is important for my sport. Just like we convince ourselves, those negative things over time when it's not actually true, right? We have to let time go by to allow this reframed statement to take over, and then the athlete will start to hopefully accept it and believe it. And if we don't attack that self-talk over time, we can see it turn into a pretty unhealthy relationship with food, with exercise, with body image, and ultimately see some disordered eating patterns.
And I want to ask you about that. What's the difference between an eating disorder like bulimia or anorexia and the term disordered eating?
Yeah, that's a great question. I think a lot of people probably wonder that too. So there's sort of like a spectrum of eating that people fall on. So on one side, we have sort of this optimized nutrition, and that describes eating that's going to be safe, it's supported, there's purpose behind it, and ultimately it best balances health and performance. And so on the other side of that, right, we see a diagnosed eating disorder. So someone who's diagnosed with an eating disorder meets very, very specific and strict criteria associated with the patterns that they have in their feeding and eating behaviors. And when someone has an eating disorder, they generally are engaging in multiple behaviors with more frequency, more intensity, where the level of their obsession with food, exercise, and their body image and behaviors, they're very present. They cannot be ignored. And then in the middle, we have sort of this gray area of what we call disordered eating, and that involves a plethora of problematic eating behaviors that fail to meet that strict clinical diagnosis criteria for an eating disorder. And it can be really difficult to identify some of those behaviors as problematic, and in fact, a lot of them are normalized in our population and the society that we live in, but also because there's just no standardization of these disordered eating behaviors. So one of the best ways to determine if that behavior is problematic is to check in with intentions behind, why something is happening. Why are you eating this food? Why are you doing this exercise? And this sort of gives me insight on whether that relationship is healthy or not. So some themes that I like to look out for include, having a very strict food or exercise routine whenever we're attaching feelings of guilt or shame, when we're going outside of that routine, and then this fixation on food, body, exercise that's really starting to affect quality of life. Sometimes we see weight loss supplement usage, and then we also see these compensatory measures to sort of make up for food consumed, such as choosing to exercise more than you would or harder than you would, restricting food, fasting, and then sometimes purging mechanisms of will. And then, of course, in the world of sports and athletics, I think it's very, very important to have awareness of these disordered eating behaviors, and that's something that I do in team settings sometimes is go and provide education to coaches and parents and families and understand what things may be problematic, because ultimately they can be precursors to actual eating disorders.
Gosh, I'm hanging on your every word, Sarah. As having young kids, I think this goes across the board, whether you have athletes or not. It's just really so important. Great tips to look out for with our kids. If you have questions about diet, nutrition, or the health system's female athlete program, send them to us on YouTube, Facebook, and the Medical News Network. There are links right there on your screen. But let's get a quick check of our COVID count. Dr. Dana Hawkinson joins us. He's Medical Director of Infection Prevention and Control. Good morning on this Thursday. How are you?
Yeah, hi. Good. Right now, COVID count, it's about the same as yesterday, 52 total cases, 32 active. Unfortunately, still a lot in the ICU, 7 in the ICU and 2 on the ventilator.
Doc, there's an important meeting happening today about Paxlovid, the pill for high-risk COVID patients. An FDA advisory committee will vote on whether it should get full FDA approval. Patients are already getting Paxlovid under emergency use authorization, but there is some concern with how it interacts with other drugs. What do you know?
Yeah, I think, number one, I think Paxlovid has shown to be a very good drug. It certainly reduces, especially people who are at high risk, it reduces their risk of hospitalization and death. We've always known about this significant interaction with other drugs, and this is not new either. We know that HIV drugs, for instance, can have interactions with other drugs, and those drugs have been around for quite some time. But the drug-to-drug interactions are significant, but there are ways to get around that. Number one is make sure you're talking with your medical team or your pharmacist. Do you need to cut back on some of your chronic drugs for just a few days, or do you need to monitor some of the effects of those drugs while you're taking Paxlovid? There are a few absolute contraindications, but again, if you are at high risk, if you can get on Paxlovid, it is absolutely a good drug to get on. I think that's very important, and just make sure you're talking with your medical team about that. Second, people are really concerned about rebound after taking Paxlovid. I would really say that should not be a concern. We know that rebound can happen even if you don't take Paxlovid. And also, if you do have a rebound in symptoms, we know that there haven't been any severe cases of those rebounded patients. So rebound should not be a concern, but it is a very good drug. I'm actually happy we haven't seen any clinical resistance yet at this point in time. Certainly we know when treating viral illnesses, that is always one of the things we need to watch for. But overall, Paxlovid is a very good drug. It does help reduce your risk of hospitalization and severe disease, and I hope it does get the full approval today.
All right, Doc Hawk, thanks so much. As spring training continues in Arizona, our health system doctors are making sure Royals players are healthy heading into the regular season. We asked assistant team physician Dr. Jake Brubaker about the importance of diet and nutrition.
We care about diet and nutrition because it's the fuel that allows us to have excellent performance and support our immune system and our overall health. It also allows us to recover from our daily activities and prepare for our next set of day-to-day activities. If someone wants to build muscle, it's important that they have a balanced diet. This includes carbohydrates, healthy fats, and lean proteins. If someone is very interested and wants to learn more, it's always reasonable to work with a sports dietitian that can help set up a plan for them. When an athlete doesn't eat right, it can really impact their mental and physical performance. It can also impact their ability to recover. It's critical to eat a balanced diet that will allow them to be at their best, both mentally and physically. And remember, go Royals.
Absolutely, always. Tomorrow we'll have head team physician Dr. Vincent Key joining us live from Surprise and get his thoughts on new rules that are speeding up baseball. Dr. Vopat, for the past 2 days, we've been hearing about the female athlete program that you are responsible for bringing here to the health system. We heard from a sports psychologist on Tuesday. Then on Wednesday, we saw what a grind injury rehab can be and what that injury is like. Today, we're talking about nutrition. How does a patient benefit from having all of these specialties at their hand?
I just believe in holistic care of the athlete. So we're not going to just focus on the injury at hand. We're going to figure out why it happened. What are the reasons that injury occurred? What are other things that we can do to optimize your recovery? And that includes bringing in dietary consults, optimizing nutrition, talking with our sports psychologist to make sure that there's no roadblocks from a mental health perspective, and getting you back to full performance.
And if you want to read more about the female athlete program here at the health system, we are putting a website on the screen. It is kansashealthsystem.com/female athlete. Dr. Vopat, one of the key differences between men and women, and we've been talking about them, treating them differently, but one big difference is hormones. How does sports change estrogen levels for women?
Yeah, so sports in of themselves don't change estrogen levels. It actually has to do more with the amount of fuel the body has. So if the body has adequate energy needs, then it's going to make all the female sex hormones to the most optimal levels, which then in turn will improve your sport and performance. It has to do more with the fueling of the body that changes the estrogen levels when girls are active. So there's still this narrative put out by a lot of general practitioners that, maybe it's normal for a very active female athlete, say an adolescent athlete, to lose her menstrual cycle, which is an indicator of the level of the female sex hormones within the body. But this is actually never normal, and it's never normal even in the setting of athletics. What that means to me is that you're not fueling your body optimally. Your body doesn't have the energy to create optimal levels of female sex hormones or estrogen, and then you're going to have some physiologic effects of that. And so sort of the canary in the coal mine, if you will, is an irregular absent menstrual cycle that should always be taken seriously. It's very common, but it's never normal and needs to be looked into.
Good to know. There's a condition called RED-S. What is that?
So RED-S is a new term put out by the International Olympic Committee in 2014. This was to expand upon the term female athlete triad, which is a term we've utilized for over 50 years. Indicating that we notice that in very high-level female athletes, they would have a tendency to have irregular absent menstrual cycles, increased risk of reoccurring stress fractures, low bone mineral density, and the setting of possible disordered eating. But in 2014, the International Olympic Committee was like, wait, no, it's so much bigger than that. What they're describing is actually a low energy state in the body where your body is energy deficient. And this doesn't just affect the components of the female athlete triad. Every single physiologic system throughout the body is affected by this low energy state. And it's also a term that doesn't just apply to females, even though it's more common, easily recognized in females. It is a condition that can occur in males as well.
We're focusing on females today, so I got to ask, what female athletes do you follow and keep an eye on?
Yeah, I'm just a lover of Olympic sports. That's where I love to watch my female athletes perform almost at every level across the board. So.
Are they a different type of athlete? I said not just your run-of-the-mill pro, but what's the difference between the mindset and the physicality of a pro versus the other type of pro, which is an Olympic athlete.
Yeah, I love Olympic athletes because I think it's accessible and it's tangible for the everyday person. There are so many opportunities, so many events with so many different skill sets that you have athletes across the board just doing things that are amazing, opposed to the traditional professional sports in the United States.
Where people can actually envision themselves standing up on that podium.
Yeah, I love that. I always love to be able to envision myself being able to do something to that elite level.
Something that's spectacular. Sarah, how detailed do you get when you make a meal plan for a patient? Are you measuring every ounce, every calorie? What does that look like?
Yeah, so the answer is no. We're not measuring every ounce and every calorie. You know, could we get that specific? Yes. Is it necessary? Absolutely not. I actually had this conversation with a patient recently, and they told me, hey, before I was talking with so-and-so, and they gave me this really detailed plan. It had my calories, it had my macronutrients. I was tracking it in a calorie tracking app, and they were sort of confused why I wasn't doing that. And so I sort of just told them, what I see a lot of is sometimes harm done with the encouragement of this strict food journaling, having to meet your macronutrient allotments to the T, same with calories. And a lot of my athletes identify as people who are very dedicated. They have perfectionist type personalities. And that can also be easily translated into their eating pattern as well, where in reality, we really don't need to be that, quote unquote, perfect or dedicated to daily fueling to see amazing results. So a simple graphic that I like to use with them is what's called a performance plate. And so that just adjusts serving sizes based on essentially their training load for that day. So for example, if an athlete is on a light training day or a rest day, I direct them to fill their plate at mealtime with half of it fruits and vegetables, a quarter of it with protein, and then the last quarter filled with carbohydrates. However, if they're doing a harder training day, maybe it was game day, competition day, where their energy output's going to be greater, we change that a little bit and we make half of our plate carbohydrates, since our body prefers that first for energy, and then we still continue with a quarter of your plate protein, and then we move into a quarter of your plate with fruits and vegetables. If athletes are doing this, for 3 meals a day with 1 to 3 snacks thrown in there, depending on their specific needs, oftentimes that's a huge improvement from what they were doing before. Now, I do also make more specific individualized fueling plans for patients where, their calories and their macronutrients are getting a little bit more, taking into more consideration, but the plan is presented to them in a way that puts an emphasis on more so serving sizes and nutrient quality rather than the calories and macros. And that's sort of just personally how I run my clinic. So it is still very individualized to the athlete's need, depending on where they are with their relationship with food, and always maintaining still that healthy relationship and not having to perfect serving sizes and things like that.
And Sarah, with so many books, blogs, articles about nutrition, you name it, what kind of battle or false information do you hear from patients, and how do you redirect?
Oh man, where do I start? I feel like
I know, right?
I feel like we're still hating on carbohydrates. Dr. Vopat kind of talked about that. So many people still come in with misconceptions around carbohydrates, and oftentimes, even if they're not, limiting them on purpose, they still underconsume them, and that can lead to overall performance deficits. It's not uncommon for some of my athletes to need up to 600 grams of carbohydrates each day to maximize their nutrition needs. And going off of that too, sort of this idea of sugar or sports drink that fits in that carbohydrates category. I do get a lot of people that don't drink sports drinks who are very, very active because they heard they're bad for you, or they have lots of sugar. And so, I think anything with sugar in it is probably going to still be deemed bad, and that totally encompasses sports drinks because, yes, simply put, they are sugar. But when we use them correctly around activity, it's not like the athlete's body is just sitting there storing all of those calories. What it's doing is it's rapidly replenishing the energy stores they're utilizing during their activity, while also optimizing hydration with the addition of electrolytes as well. So let's stop hating on carbohydrates and sugar, specifically for my athletes, and start to learn how to incorporate them appropriately to maximize your performance.
Dr. Vopat, same question. You gotta love social media and the power of scrolling to get all that accurate information. What do you tell patients who might be misinformed?
I let them know that there's inherently no moral value to food. There's just appropriate times and places and amounts.
So no good and bad?
There's no good and bad. All foods fit, right? So, that's one thing we focus on. And then especially when nutrition is used as a performance advantage in sports, I like to tell my athletes that there's a time and there's a place. So it has to do more with the flexibility of the mindset more than anything. So when you have an inflexible mindset of someone who dedicates themselves to a certain way of fueling their body, they do it during season and out of season, and then start to have any health decrements because of that, then those dietary preferences really have no place in performance for you. And so it's making sure that if you are doing things in the name of performance, that there's a time, there's a place when you do it in season versus out, and then you're able to go back to your typical dietary patterns of your body needs to fuel itself in and out of season.
Do we have any reporter questions on the line today? Let's get to our viewers. Here's a good question from Jeremy. He says, I have a few young daughters at home. Wow, a few. That's a lot of daughters. When is it appropriate to start looking at sports performance and the diet side of athletics? Is it more at a certain age or when they reach a certain dedication level? That's such a good question. Sarah, I'll start with you.
Yeah, I don't think there's a magic number. I think sort of just looking holistically at the athlete and understanding what their goals are and where they want to be. And that's sort of why the female athlete program is great, because oftentimes people will come in for one thing and then we start to recognize that maybe it would be a benefit to look into sports nutrition as well, or vice versa. So I don't think there's a magic number, but understanding why sports nutrition can help elevate athletic performance and also prevent injury, and sort of understanding what that looks like in your specific athlete.
Yeah, and Dr. Vopat, I like that question. I have a 10-year-old daughter. She's a swimmer. She's not swimming every second of every day, but she's part of swim team. But you can see Jeremy's question is, because you don't want to deplete anything from a 10-year-old's little growing body, but you also you want to make sure you're replenishing it if they need it. So how do you talk with parents about that?
Yeah, again, I like the kids to fuel to hunger, especially in the younger age groups. And then when they become more intense, it becomes more intentional fueling, and making sure that most adolescent athletes in a growing skeleton need at least 3 meals and 2 to 3 snacks, especially if they're active in sports. When it comes to sports performance, it's really important to intervene as soon as possible, or teaching proper movement patterns. Some of the science actually shows these days that we should be intervening, especially in terms of movement patterns, to prevent, for example, an ACL injury as early as 8 to 10. And if we're waiting until the middle school or even high school age groups to focus on starting an injury prevention program, then we may have missed the boat. Now we can still catch up on that, but the earlier you start, the better. So it's not unreasonable to think that you can get your 8 to 10-year-old in a training program that looks at adequate movement patterns, balance, body, sensation of body in space, proprioception, and then work on strength training thereafter.
Terry wants to know, and you touched on it a little bit earlier, but expand on this. How has sports medicine improved since you were playing soccer?
I think that we're just a lot better at looking at the whole person and individualizing care. That's what we believe in our clinic, and I think that's where the science is headed. Looking at these females as unique beings, and then separate of that, just looking at them on the individual level. And that if you're going to see us, it really behooves me not just to treat the stress fracture that you came in, but figure out why. How can we optimize your nutrition? How can we optimize supplementation? How can we affect the mental health that, may have changed in the setting of this injury? And what can we do to prevent this injury in the future, whether that be a strength training program, whether that be a gait retraining program? There's so many ways to look at the whole individual and not just the problem.
I want to get to final thoughts from our guests. Great conversation. Sarah, I'll start with you. Final thoughts for our viewers today.
Yeah, I think 2023 is a promising year for the female athlete. Our female athlete program's established. I know Dr. Vopat and I are going to go to the Female Athlete Conference this summer in Boston, which we're super excited about. We're really just starting to understand the need for more research to be done and more discussion really to be had about this highly prevalent subset of athletes, females, because we as females are really so different than our male counterparts. And this also translates into sports nutrition and how we fuel the athlete as well.
Dr. Vopat, final thoughts.
Yeah, I would say that the world of the female athlete is just exploding, and I feel an obligation to contribute to the science behind that. So not only are we clinically treating our patients, but we hope to generate research on our female athletes to further the field and improve not just the quantity, but the quality of research that's out there.
Yeah, they're not just there to watch and enjoy. We got to keep them healthy while they do it.
Yep.
For the long run.
That's
Dr.
right.
Vopak, great. Thank you for the work you're doing here for our female athletes and beyond. Dr. Hawkinson, final thoughts.
Yeah, thank you both. It is so vitally important for female athletes. Even if you're not a full athlete participating in high-level sports, it's so important to be out there recreational, to be active. We know that organized sports do help females to grow and be healthy, both physically, but also emotionally and socially, and so it is so vitally important. So thank you to our guests. And just one more piece that we continue to add to that, having that healthy lifestyle, doing the activity overall is going to help your general health.
Totally putting you on the spot. Who's your favorite female athlete? Quick.
I don't want to say Serena because that's an easy one because she's done so much. But I have to probably say Mia Hamm.
Yeah, I was going to say, you got to do one of your soccer girls.
Yeah, absolutely.
I do it.
Absolutely.
I do it. Oh, they're all great.
Kind of a little bit older, or Michelle Akers, obviously just a pioneer in the sport for sure. So.
Fun to watch.
Yeah.
They're amazing athletes. Well, with St. Patrick's Day tomorrow, we know a lot of folks will be drinking. No judgment from us, we promise, we swear. But Alexis Del Cid shows us there is a connection between drinking and heart rhythm disorders.
Have you heard of holiday heart?
No, I have not. No, I haven't. No.
While holiday heart may not be a familiar term, a basic hangover has happened to the best of us.
Have you ever had too much to drink?
Yes.
Whether it's that one time in college or your best friend's wedding last month, most of us have overindulged at least once in our adult lives. And for many, once was enough.
Loss of equilibrium, inability to think straight, and inability to reason, loss of inhibition.
With drinking, it kind of slows down motivation a little bit. It makes you tired, makes you not want to be as active and stuff.
But avoiding alcohol altogether can be incredibly difficult, particularly around St. Patty's Day and spring break, not to mention that references to drinking seem to be everywhere you look or click these days.
Oh, how it's wine o'clock somewhere, or you just, everywhere I go there's a t-shirt or a towel or a magnet or something with it on it.
About drinking.
About drinking.
I definitely think it's become so normalized drinking. There's everything you do is drinking, the paint and sip, you know what I'm talking about? I don't know, I think it's become so normalized now, and social media probably plays a part into that for sure.
It's definitely a huge influence of, drinking and stuff.
But can 1 week or even one day of drinking more than usual really have an effect on your heart? Cardiologists say absolutely. Holiday heart is very real, manifesting with heart palpitations, a racing heart, and or shortness of breath. In fact, a recent study funded by the National Institute on Alcohol Abuse and Alcoholism shows just one glass of wine or beer or a cocktail can have an immediate effect on your heart rhythm, significantly increasing your chances of atrial fibrillation within just a couple of hours, even if you have no underlying history of heart disease.
Long story short, everything in moderation. And if you feel your heart racing after a few drinks, consider asking your doctor about that. Well, All Things Heart is coming up today at 10 a.m. and we have the health journey of a nationally acclaimed artist living right here in Kansas City who got the most frightening news about her heart.
It's like you're a walking time bomb. You don't know when it's going to explode. It's pretty terrifying,
We'll show you how our health system doctors saved her from that ticking time bomb and the beauty she is now creating. That's coming up on All Things Heart at 10 a.m. Thank you again to our panel of guests today. Thanks to our viewers for watching. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, baseball is back and faster than ever. New MLB rules are speeding up the game. I'm Jessica Lovell on the next Morning Medical Update. We go live to Royals training camp in Surprise, Arizona, and ask the Royals top doc how a 15-second pitch clock changes the game. That's Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.